You have to tell me when we're live.
Live.
Hello, everybody. Welcome to PBS Together. And thank you so much for joining us. This is our free webinar series for those who have joined us. Yeah, excited today because we're going to, oh, my mic is off. Can anyone hear me or not? No?
I can hear you.
I think
Yes.
just shut up for a minute.
Sorry,
there.
It was a glitch. Come back.
Apologies for the glitch. So we're super excited today because there's been so much negativity about PBS in Australia lately. And even before the recent challenges around the NDIS, I've noticed that a few months prior to that, LinkedIn was just full of negative comments about PBS practitioners or about PBS in general. And it's always the squeaky wheel and the negative voice that gets the space. And we want to disrupt that. There are so many really amazing organizations doing some amazing work every single day. PBS practitioners are out there really changing lives and are doing some amazing work and advocating for people and giving people a voice and control in their own lives. And there is nothing more powerful. It is the best job in the whole world. There's nothing better than this work. And we really want to share all the great things that are happening in the space. So we've got 8 panelists this morning joining us from really diverse organizations doing all sorts of different really cool things. And we're going to go through, and I'm just going to say the names and their roles initially, and then I'm going to invite each of them to give us a tiny 5 minutes. Is so much of a short period of time, but 5 minutes to tell us all the amazing, really cool things about what they're doing in PBS in their organizations. And then we're going to open it up for questions. So today we've got an hour and 15 minutes, a little bit longer than usual. We are going to keep everyone to their 5 minutes. Helda's going to do a bit of bell ringing. You'll hear a bell go off when the panel members have got 30 seconds to go, and then 2 bells when they're really in trouble and the time's entered. And then we're going to open it up for some really good discussion and some questions about all the great things that people are sharing with us today. So our panel members are Amy Flynn, State Director from Queensland from Chameleon Group. And full disclosure, I am the co-founder and still managing partner of Chameleon Group. So just letting everyone know that. Wave, as I say your names, Amy Hall, the founder and director of Banksia Support Services. David Dinser, the founder director of Ignite Healthcare. Don McCaskill, founder and managing director of Butterfish. Jess Kaufman-Wood, a clinical manager at Insight PBS. Julie O'Brien, National Director of Operations of Liberty Behavioural Services. Mitchell Bayliss, Founding Director at CB Change. And Sarah Mikulski, the Founder Director of Billy Cart Behaviour Services. So thank you to each panel member. Thank you so much. We're just going to get started. I'm just going to go through alphabetical order. Nobody really wanted to go first. Oh, I think Jessica said that she didn't mind. So let's get started. And please use the comments to chuck in some comments or some questions that you want to ask the panel members as we go, and then we'll have some time at the end. So Amy from State Director Queensland from Chameleon Group, we'll hand it over to you.
Thank you, Tracy, and hello, everyone. It's such an honour to be here. I know Tracy declared that we already work together at Chameleon Group as well, but I still feel very honoured and privileged to be here and be in a room with so many other amazing practitioners and leaders in the field. At Chameleon Group, we really focus on quality and clinical excellence, but to do that, we need to have sustainable practitioners and practitioners that are regulated and can actually do the work. So that's a big passion of mine personally and has been passed down from Tracy and other people that work at Chameleon Group. So to do this, we have small supervision loads. We have supervisors that only have 1 to 3 supervisees. So that means they've got constant contact with someone and someone that really knows them and their caseload to offer that support ongoing. The other thing we really prioritize is well-being checks. So in supervision, it's not just about discussing clients, but it's discussing you as a person and how you're feeling and how you're going. We keep these groups local if we can, because we are a remote company. So we don't have an office. We have an office in Sydney, but everybody else in other states, such as Queensland, we work remotely from home. So we learned a lot through COVID about the need for connection and people working together. So by having local groups for supervision, it gives you that chance to have face-to-face support when you need it. And we encourage practitioners to get together and spend that time together and learn from each other and work together. The other thing we do is we have fortnightly communities of practice in those local groups. So you're, again, learning from each other and picking cases and topics that are really interesting to you. And then we'll also meet as a state when we want to do other trainings and learnings and connect with each other. And a big thing we do in these little groups and across the whole company is we focus on those positive moments and talking about times with clients or with each other that we've had wins. That's something that's championed and we like to talk about to inspire each other and keep us motivated. We use the BSPQE2 for clinical development and to help people develop their plan and assessment skills. And we also have compliance checks for all comprehensive plans. And I find this, from a practitioner perspective as well, such a nice safeguarding, and I feel supported by a chameleon group that I've got someone else's eyes over my work and checking the compliance side of things. And I learn a lot from that experience. And it's a great opportunity to build development again. And the other thing we're really focusing on at Chameleon Group is visibility. So that's something we're really proud of, that our clients, they know who we are, they see us regularly, whether that's face-to-face or telehealth, and they're having that contact ongoing, whether it's in the assessment period or it's in that implementation process. We are there every step of the way and offering that support, training, and insight. And I wanted to highlight a practitioner win, because that's something we love to do at Chameleon Group, and especially in Queensland. With the recent changes and travel impacts, we had someone who proactively was recognizing that some of their caseload was being really impacted by allied health not being able to travel anymore, and even medical professionals having limitations on travel. So they've worked with their client and they've got a full-blown skill development plan in place and supports to help them learn to utilize telehealth, which I just think is amazing and such a showcase of how we can pivot in PBS. I love being in PBS. It's one of the best fields because you have such impact for people positively and you get to do so many different things. It's not a cookie cutter approach. It's not the same thing every time. It's so individualized, person to person. And even when there's negative noise in the field for whatever reason, I think that comes from us being innately humble. I think the field is full of humble people that just get in and do the work, and we don't always attribute those positive changes even to ourselves sometimes, because we're constantly reinforcing the people implementing our plans and who have co-developed those plans, because it isn't just us doing these things. We're working in a team environment for our stakeholders and for our participants. So that humble nature we have, which is what makes the field so great, is also why I think there is sometimes more negative noise than positive noise about what we do, because we're just too busy doing the work and we're always trying to share that acknowledgement across individuals that helped co-develop these plans and the participants themselves that consult with us and tell us what they want out of service and what they want from other people. Oop, there's my bell. That's good. I don't know how I was going for time. Thank you. So yeah, thank you so much for the opportunity to speak on this today, and I can't wait to hear from everybody else.
Thanks, Amy. Thank you so much. So next we have Amy Hall, the founder and director of Banksia Support Services. Another Amy, over to you.
G'day guys, how you going? Oh, bit of fangirling. I'm a bit fangirling right now. I'm in the room with some bloody legends. Okay, 5 minutes. No one's ever got me to talk under 5 minutes, so this is going to be a gold medal achievement. Right, so I'm a behaviour practitioner. That's what I call myself, but I've been an educator, a youth mental health advocate, a child and adolescent specialist, and I don't like grown-ups very much. I'm an autistic person with ADHD, chronic illness, and I've got learning disabilities. So when I say I don't like grown-ups, I'm not trying to be offensive. It's just that kids and young people, they make sense to me. They've always made sense to me. Adults sometimes are just really hard to work out. So as an autistic person, I've kind of needed to embrace some of the things that, especially as a business owner, that I haven't really been able to wrap my head around. So 5 minutes. What does Banksia do? Banksia was born in a neonatal intensive care unit about 4 years ago. I was sitting in there. My daughter had been born 14 weeks early, and I come from a rural and regional community on the south coast of New South Wales, and there wasn't a lot of providers. I was working for a provider, and I'd established their behaviour support framework. And, you know, this is when the commission was in its infancy, and it was like, right, what are we doing? How do we do this properly? I was in this hospital, and I'd given birth. My little girl decided to make her way much earlier than usual, and my business idea was born there because I wasn't a huge fan of the way that my own organisation supported me. You know, I was I'm an educator. I'm not an allied health provider. And so I was already seen as being less than because I didn't have a psychologist next to my name or allied health next to my name. But I've had over 10,000 hours of training, practice and work. You know, I know these clients really well, and I make it my point to know them really well. So that's where it was born. 4 years later, the evolution of Banksia is that I worked out real quick that I'm a terrible manager. About 4 months after I started my business, I bought a 9-room building and stocked it full of staff. Bad idea. Thought scaling was the best thing. That's what I was supposed to do to scale my business. I had no bloody idea. I'll be really honest with you. What I knew was behaviour support. I knew my clients. I knew that. That's what I knew really, really well. Business, that's a whole other ball of wax. So what I decided to do was, once I'd worked out that it was going to kill me, literally, the stress of it was going to kill me, I downsized and I offloaded my staff. I offloaded about 80 clients and I'm really proud of this, 90% of my clients went to other comparable providers in our local area. And I used every favour that I'd curried over 4 months to get them comparable services. So I went back to being a sole trader. And so for me, I've got one employee, but I'm really happy in that space because what it allows me to do is be really divergent in the way that I operate. So Banksia's client journey, even still, is extremely strong. And I don't see the client journey as being when the client starts their service and when they end. I've got clients that come in and out of my services fairly fluidly when they need it. So that's why most of my clients, they're not with me forever because they don't need me. Best job I could do is when they don't need me anymore. However, life happens, let's say, shit happens, things happen where they need to come back in and get additional guidance, and that's where I'm available. So the client journey for me, I say it's about 2 degrees. If I could shift the trajectory of a client's 2 degrees in any particular direction, then the long after I've left their life or left their service necessarily, then I've shifted the trajectory of their life in some small way. That's what I aim to do. I am also a clinical supervisor. You can take the girl out of the school, but not the school out of the girl. You know, I'm an educator. That's what I am, I think. And so as a clinical supervisor, I've got over 3,000 hours of experience with hundreds of practitioners right across Australia. And I've currently got 65 on my roster. And out of that came my desire to help build and lift our sector. You know, as a leader, as an autistic leader, I'm not someone who's comfortable being out in front, even though I often see people often know who I am before I know who they are. It's not my intention. For me, a good leader is someone who's underneath and they're lifting people up and they're leveraging people up, but they're also problem solvers and solution seekers. So that's kind of how I look at my work in the behaviour support space, but also in terms of sector leadership and sector development. It actually makes me feel like a complete idiot when I say that I'm a sector leader or I'm an aspiring sector leader. It's stupid for me, and I know the bell's gone, because it's not ever something I've ever been comfortable in. But I'm really keen to learn more from other leaders so that I can be a better one myself. 5 minutes, bloody hell, that's a lot. That's hard.
You did it, Amy. You did it. Oh, well done. Amazing. Thank you so much. I know everyone's got so much to say. It's really tricky to get it down in 5 minutes. And please, everyone, any comments, questions, throw them in the chat and we'll get to them at the end of our panel presentations. So David Dinsar, founder director of Ignite Healthcare, over to you. 5 minutes.
Thank you so much, Tracy. So I'm actually here like stepbrothers interviewing with my best mate in the business and a clinical excellence lead with Bridget as well. So I'm going to give her some space as well to speak. I am a physiotherapist here. I snuck in somehow, but I guess it's because Ignite Healthcare, we provide allied health services. And we really actually care about behaviour supports as well. Much like yourself there, Amy, my journey here started off with lived experience where my family, we saw what life was like before the NDIS when my niece was born with a severe level of cerebral palsy. And we saw just what truly valuing somebody can lead to when there weren't other supports around. So for us, it was saying that Alice deserves an opportunity and a good go at life, despite what the medical model was giving her a chance at. And because we gave her a chance, at that time, we remortgaged the family home. We did whatever we could. We did crowdfunding ourselves, going from church to church. I used to share the message about Alice back in those days. We kept her home safe and alive. And today she's 19 when they gave her no chance of living past 1 year of age. And so I'm a big believer in hope as well. And it's also why Ignite Healthcare, we're here to not just take part, but actually shape the direction of the sector influence, because the reality is they're servants of ours. Yeah. We forget that sometimes government, whether it's aged care, whether it's disability, they're servants. We're their shareholder and we need to hold them to account. And so we believe at Ignite, that's exactly what we've got to do. And so I hope we're doing an okay job. I'm going to hand it over to Bridget here because Bridget, I want you to speak about
it's a really
supports.
Yeah, no, it's a really good segue. I think I think one of the things that perhaps isn't lacking or just something that we can improve on in helping educate future clinicians and maybe even current clinicians is that it is such an honor to receive a plan and to receive funding and divide that in a way and think of ways to spend that in the best way possible for their life. This isn't just about, writing a piece and going like, oh, okay, well, here are some strategies. Like it's a massive, beautiful responsibility, right? And the other thing in talking about, I'm not going to so much talk about what we do here with behaviour support. Of course, we have quality assurance things. And of course, we go through all the ethical ticks and boxes and, making sure we're auditing and doing everything ethically. But I'd love for there to be a side as well where the educational efforts and the what was I going to say? Just the efforts that clinicians put in to learning their craft, to doing external work, to getting their clinical supervision. There is so much that goes on behind the scenes that we probably don't talk about often enough. And even those times where I'll be in the shower going, okay, hold on, that person just popped into my head. Something comes up, a strategy that pops up in the car on a Saturday. And it's that idea of we do separate ourselves from our clients, but it is that passion that they will pop up. And that's such a beautiful thing to talk about as well. And we really, really, really care. And that's probably something that isn't always discussed. It's like, well, they're just clinicians and people are used to clinicians and those in the medical industry, I suppose, being a bit colder. That's also a thing I've heard a lot. There's this kind of, not a distrust, but this warmth or this humanistic aspect that I think sometimes, in certain sectors of healthcare is missing, and that compassion for lots of different reasons, burnout, all sorts of things. So that's why we need to look after ourselves. But I suppose before, I know I'm speaking for a while, but what is so great is that we're all here collaborating. Even though things have happened, it is so lovely to see faces that I speak to on weekends about random things. Hello, you know who you are. And we've all connected. And we're now swapping this information instead of thinking that we have to be in silo, which I don't think was something we wanted to do. It was just kind of like how it was. Yeah. And now things are changing. And it's like businesses don't need to compete because it's not about the businesses. It's about the people.
Amen. Yeah.
And our participants choose clinicians based on their needs. They don't choose businesses, they choose clinicians. We need to rethink that. So yeah, that's what
I love that. I want to
to
tie a bow. 10 seconds, okay, Tracy. I want to just share that. In the just to kind of piggyback off of the point of we've come together to collaborate. What I love about that, it goes back to what I raised before. We've been too often in competition. The reality is we're equal parts shareholders, and we have to keep people accountable. And what we want this sector to look like, behavior sports to look like, is really in our hands if you want to grasp it and see that opportunity. And so this is what hopefully the start of something amazing. And I will say one more thing. I love that we're sharing good news.
Ding, ding, mate.
Okay, ding, 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 ding. Amy, I told you said you speak too much. I am actually. Guys, I love that we're highlighting hope and the good stuff here, because the reality is hope motivates people towards action and to hold people to account. And despair and bad news is inaction and people give up. So that's it. That's me. Thank you so much for having us.
Thanks, guys. Thank you. Okay, over to Don.
So hard, Tracy. So hard.
You did well. You did well. Don McCaskill, from the founder and managing director for Butterfish. Welcome, Don.
Thanks for the opportunity to be here. So Butterfish, everybody goes, what the hell's with that name? Butterfish Services started 9 years ago, and Butterfish is actually my Aboriginal totem, so hence the name Butterfish Services. Butterfish Services came about as a result of a challenge, actually, over a coffee 9 years ago, when I was the CEO of a disability organisation, and I was venting my frustrations to a colleague about the fact that a lot of boards talk about person-centred, talk about outcomes, talk about empathy, etc., but they don't really walk the talk. And then the challenge was put to me that, well, why don't you just go off and start your own organisation? And that's exactly what I did. And I started the organisation purely based on the passion of I just wanted to make a difference. And that difference originally was focusing on Aboriginal people and providing culturally appropriate support, particularly around positive behaviour support. And that was really born out of the fact that a lot of organisations put out that they're culturally appropriate and that they are there to meet the needs of Aboriginal people, but there's this huge misconception that Aboriginal people, just because you've got culturally appropriate staff, perhaps, that Aboriginal people are just going to walk through your door. So my approach was definitely person-centred. So I went out and I started actually visiting people, Aboriginal people, in their homes. And you really can't understate the benefit of that first genuine conversation over a cup of tea or a cup of coffee. And you cannot underestimate the power of being an active listener, not being there to tell the participant what you can do for them, but coming from a position of how can I help? And I think that often is being lost in our space right now, is that there are a lot of providers out there that are just going out there and saying, this is what I can do for you. As the guys just expressed before about the privilege of somebody coming to you with a plan, it is a privilege. It's an honour to be asked to work with a participant and to guide them through that PBS process. So it cannot be understated that first human interaction of how can I help, and then the next part that I think is really, really important is managing expectations. I think that's, part of the negativity that's in the space right now is we've got a lot of PBS providers out there doing a lot of work, but not really explaining very well what the process is. And I'm not talking about the entire process, but every step of the journey. How am I a partner with you through this process to achieve the outcomes that you want? Not necessarily the outcomes that you need to tick off from a plan or a compliance point of view, but how am I working hand in glove with you to achieve the outcomes that you need in your life to maintain your quality of life? So, I think all of us are in this space doing lots of great things, but as we've all said, we're all busy just doing. And we're not very good at promoting the good things that we do. And I think one of the things about being a PBS organisation or a practitioner is that we have a responsibility to educate. And that education comes with that hand in glove partnership with your participant and guiding them through the process, being in partnership with them through that process. The more people that understand what we do, why we do what we do, how we do what we do, it really makes a difference, particularly to the outcomes. And you can't underestimate the power of word of mouth, right? A participant that's succeeding, doing well, primary support networks, etc., they will be the biggest endorsers of your work and your and your success. And I think, additionally, PBS practitioners, I don't think are always underestimated for the amount of clinical training that we do have. The endless evidence-based practices that we put in place, that we've learned, that we've employed, the skills that we have, I think is often, picking up on the point that Amy made earlier, just because you don't have a psychologist next to your name, that people, it's kind of devalue what we do. I think we need to do more to educate people on that, we are, just because we don't have a psychology degree or whatever, or maybe you do, we do have that, that training, that skill base, that experience, and that expertise that is just as valuable as an occupational therapist or a speech pathologist or whatever. So
to cut you off, sorry, the bell keeps going. Sorry, Don.
I can't hear it. So okay, that's me. I'm done.
Oh, sorry. I'm so sorry. Do you want to add last word?
No,
Don?
no,
Sorry.
go. It's all good.
Okay, sorry. I'm sorry I didn't hear the bell. It's probably not loud enough. My apologies. Thank you so much for sharing that, Don. Really appreciate it. Next is Jess Kaufman-Wood, our clinical manager from Insight PBS.
Thanks so much, Tracy, and thank you everyone for having me. I'm so grateful to be here with so many others who are really passionate about positive behaviour support and what we're doing in this space. So yeah, I'll share a bit about what sort of drives us at Insight PBS, especially around how we keep quality high in our service and also ensure that our staff are genuinely supported. So we've got about 70 practitioners now across 4 different states, and we've just turned 4 years old. And really, I guess what's at the heart of everything we do is our people. We're really, really intentional about valuing our practitioners and participants equally, because I think we've all probably been part of a really toxic workplace in the past. I know I certainly have. And we knew from the get-go, I suppose, that our practitioners, if they feel supported and respected, they're going to be able to deliver the best, most empathetic, services possible. And so I guess what that looks like and means to us, because we have a fairly large team now, is making sure that things like KPIs are really realistic, that we do genuine wellbeing check-ins, that we do weekly team leader check-ins. We have a work health and safety committee. We have a neurospicy group run by some of our neurodivergent practitioners and leaders. And we also try to focus on having a really clear pathway to grow your career so that practitioners feel like they can stay and build a future with us. And so we're really proud that our turnover is actually very low, and that this year we actually were recognised as a 5-star employer of choice, which is just a really lovely acknowledgement of sort of what we're doing at the moment. So I guess a few other things that we do is that we, like Amy mentioned at the start, we also really try to invest heavily in supervision and peer learning. so that no one feels sort of left on their own. We keep our practitioner to team leader ratios really small. Every practitioner gets fortnightly supervision sessions, and on top of that, every team has like advanced and proficient practitioners there as well, who are great at sharing their expertise. We run things like team days throughout the year where we do company-wide PD and social activities, because we know how isolating it can be to work from home. And we've also just introduced an internal shared learning initiative called the Insight Scoop, where our practitioners can share their areas of expertise. Focus on having those sorts of opportunities available, and having a really strong feedback culture as well within the organisation. And so that's something we're really proud of, that all of our practitioners are so willing to share and be collaborative with each other. A bit about our reach is, I guess, that we really focus on PBS. Like, we really don't try to spread ourselves too thin by doing too many other things. Like, we really are passionate about PBS. And, you know, we try to make sure that we reach out and have practitioners in remote areas, you know, and in local areas where we can address those sort of gaps in sort of regional and remote areas too. And we hire practitioners in those local communities as well. We also bring new practitioners into the industry and really try to set them up properly. So we run like a 5-week onboarding program with a dedicated trainer, so that people feel really, you know, confident and ready. Instead of just being thrown into the deep end, I'm always telling them PBS is just not the most straightforward role. You don't just come in and go, this is how you do it. It's so diverse, and you really learn as you go. And so for us, it's about building really good practice habits early, making sure everyone aligns with the values of the organisation, and just giving practitioners a strong foundation so that they can provide that high quality service. I won't go into too much detail about the other things, but I was going to mention, you know, we've got some really innovative practitioners, and they build some incredible custom digital tools that we use, where, you know, it helps us, you know, have data collection, assessments, file audits, and things like that in a really efficient way, so that practitioners can focus on what actually matters, which is doing intervention, training, hands-on work with participants and families as well. I think Amy also mentioned using the BSP QE2 to QA reports. We absolutely do that as well. And we're really just trying to, you know, be a source of information in the industry as well. Like, we love what you guys are doing here, and you know, we try to have resources and things online for participants too. So that's a bit of a snapshot of what we do at Insight. But thank you all. I think I just got it there.
Oh, the bell. Thanks so much, Jess. Really appreciate it. Thank you. Next, we have Julie O'Brien, the National Director of Operations for Liberty Behavioural Services. Over to you, Julie.
Hi, everyone. Look, I might talk a little bit about Liberty at the end, so hopefully David will forgive me for that, our CEO. What I actually want to do here, I want to acknowledge that listening to everybody has just been amazing so far. You've touched on areas. I have about 20, maybe 30 little tabs around me with some talking points here, but you've touched on most of those. So I'm going to take a little bit of a different journey, and I want to take people back through a little bit of history, so that you can hopefully see what we're doing today in a much more positive light. So I want to go back nearly 40 years ago when I first started in this sector, and that was at the time of institutions. Okay, they were still there. We were still in that space. I was a kid. I was 17 years of age when I started very sort of formally into the space, and my first experience with, I guess, someone who was presenting with this behaviour of concern or this risk of harm was the setting, if you can imagine, was very it was a very sort of crowded setting. It's a very, very old, big institution. We've got all 30 odd ladies in one space, and you're getting on with your role, and someone's become very aggressive, very heightened, and the responses and reactions way back then were very oppressive, very punitive. So although my first experience was being chased with an iron bar, someone with an iron bar and sort of running after me, to be honest, I remember it, but not through trauma, through just having an experience of the person's frustration, wanting to understand that. But we were in a very difficult environment. There was no PBS lens across anything then. So this was about, control, getting control back, and ensuring that person wasn't going to hurt people. Unfortunately, there was no peeling it back and looking for a reason. We weren't looking for a purpose. And that is, when I look back at that time, that era, and I'm able to, I can put these sort of pictures, this pathway that we've taken over nearly 40 years to get to where we are today, to reduce not just what we do in this space. Our focus on reducing risks of harm is not just about protecting the person around, but it's about improving that quality of life. We know that what we are trying to achieve, with our work, is that the person will be able to, become less heightened in certain circumstances. That's not a fun experience for all of you who have been in a situation where your voice hasn't been heard, or you've met frustration after frustration, and you've finally sort of gone, enough is enough. It's not fun to be there. It's not a nice place to live in. And so you can imagine that, for us, our voices are heard. We know that for so many, their voices are not heard. So when I look back to when voices were silenced, not just not unheard, but silenced, oppressed, and I look at today and all the amazing approaches that we use in PBS, and, from where we've come from to where we are today, we should celebrate that. We should really celebrate that. That is what an achievement as a society. Now, we're not all the way there, not even close to being all the way there, but we are a long, long way from where we were. So just to give you a quick example, and I'd like you to kind of picture this if you haven't seen this before, but we talk about restrictive practices. That's a big part of our job, and a big part of the role, the work that we do. We want to reduce those, and you'd be amazed how much we have reduced those, incredibly so. We've changed the lens of society to what they can expect. But one example, just very quickly, I've got a few seconds. If you can imagine, you've got 30 ladies lined up and they're just handing out their medication like lollies. Okay, just like lollies, 7 o'clock every night, medications So we've changed so much. We've moved on. So celebrate that, everyone, because PBS, what we do, it's amazing. Enjoy it. Thank you.
Thank you so much, Julie. So much passion in the room. Absolutely love it. Next we have Mitchell Bayliss, the founding director of CB Change. Over to you. And I know it's going to be really hard, Mitch, in 5 minutes, but give it your best shot.
Thanks very much, Tracy. No, I'm lucky to be here. I've been really sick, so apologies if I have to cough through this. I'm really passionate about change. So I'm not hung up on PBS, and I'm going to give you a bit of a reason for that on the way through here. And the reason for that is that I don't devalue PBS. I actually do value PBS very strongly, but it has its place. And then anyway, I'll get into that on the way through. As a late stage practitioner, so I've been doing PBS or behaviour support for over 25 years. I thought what I could contribute that may be inspiring and challenging at the same time is some reflections on that journey. So some of the things that have taught me how to be a better practitioner, and also how to evolve the kind of framework that we're working with now, which steps beyond that. So I'm going to try and do a presentation. If this will work, I've got no idea. I'm going to press the button. It says share slides and PDF. I want to share a screen. Is that possible? No. Hang on, here comes. I can't hear you.
Can you hear me now?
Share screen, got it?
Yeah, you can share your screen and we can pop it.
Okay, share screen. Share. There, I haven't used this system before.
Here we are.
There we go. 4 realizations. I'm starting off with that. The first one, PBS doesn't work. Oh my God, what are you saying? Well, my first big wake up. So my background is IABA, so training within that framework, and within the state of Victoria, it was an adapted process anyway. It wasn't really true IABA model. But we were in the bubble of intellectual disability and in the bubble of departmental houses and trained teams. And of course, all that started to change. And we went out in the community. And we're much more in people's homes and schools, and, children in out-of-home care and youth justice, dealing with forensic settings and that kind of stuff. So, and of course, the model requires an environment. And the wake up there was that PBS for me didn't work. And that set me on a journey of saying, well, if it doesn't work, what does work and why? And that took me to the next step here. I'm trying to move fast through this. I realized that context is king. And I think it's one of the big challenges at the moment out there in the sector, and why PBS does struggle a bit is that if you look at most of the examples, they are in education, or they have been in intellectual disability, where a lot of the early research was done. And it's moving into a completely new era now in the NDIS, where it's really being road tested in all sorts of contexts. And I would argue that the basic model is really challenged. What it takes then is practitioners who are really skilled and talented to be able to move between different settings, different situations, and understand how to affect change in that space. I think if most of us would be honest now, if I was to go back to a straight PBS model, you would say, well, I do that, but I also do X, Y, Z. And that's what I think a lot of people are actually evolving their practice actually to make it work. But context is king. So what the context has, and with capable environments is another word that often pops up around this idea. The environment actually starts to determine what can and cannot happen. Most time we're doing PBS, it's in a situation of support. It's not without supports around. So we're actually having to work through and with not just the person who's been referred, but also their team, their family, their friends, their neighborhoods, their schools, their employers, everyone else in that context who's actually involved. So if we don't understand the context really well, we actually can't affect change, which is a really key thing. Well, complexity. Complexity is not a problem. Complexity is life. We're actually, the more complex life is, the more we're joined up, often the better things are. Because we are in complex situations with multiple relationships and interconnections with people, systems, services, supports around us, actually understanding those patterns that are emerging from that complexity are really key to understanding change. So understanding that with complexity, you actually can't control anything. And I think that idea of linear predictability kind of goes out the window a bit. We're in a lot of environments. And I think, is that? All right, I'm going to skip through to this one. You're more powerful than you think. I think knowing that it's complex and you're a part of that, then the ripple effects you send around are really key, and being strategic about that. I was going to go on to a little bit about our model, but we don't have time. So I'm leaving you with those thoughts. And they're the sorts of things that have inspired me to keep growing and keep pushing myself forward, and to involve a whole new different approach to practice that doesn't exclude PBS, but puts PBS as one of the models underneath a broader framework that we use. Thank you.
Thanks, Mitch. Thanks. Thank you so much. That was really good and good, thought-provoking, and to remind us all about the complexities of everything that we do. So thank you. And next is our amazing Sarah Mikulski, from the founding director from Billy Cart Behaviour Services. And just a reminder, please put your comments, questions in the comments in the chat, and then we'll put them on the screen and open up for discussion soon. So over for you, Sarah.
Thank you. So I thought I was going to be the only person that had slides, and the reason why being I would forget absolutely what I wanted to talk about. So mine is a little bit different to some of the people that have chatted today. And so I just wanted to actually show you one of the innovative ways that we've been doing our PBS at Billy Cart, and what that looks like. So I'm just going to share my screen, and it will be a little bit of a mess for a second. But so we've got Billy Cart, and this is a novel way that we're delivering PBS and training for our support teams. So, you know, we're here today because there is a huge ever-changing landscape of NDIS, and we're trying to work out how do we continue everything we're doing in such a positive way that we've heard from everyone today, but doing it in a way that makes it sustainable. One of those ways has been reducing the barriers to PBS and training supports. So what we've done at Billy Cart more recently has actually started to create on-demand trainings for our clients and their PBS plans. So this includes, from the screenshot you can see, or I hope you can see, is the course content. So this is looking at the general areas of intro to PBS, understanding RPs, and understanding behaviours. But then we actually have been breaking down and individualising these on-demand modules for our clients. So we're co-designing these on-demand modules with our clients, and it's for the client. So the example I've here is one for one of our clients. It's actually sitting opposite me, named Grace. So if you see me a little bit distracted, it's because Grace is sitting next to me.
Not touching you.
But Grace has her own on-demand modules that help support her whole team in understanding who she is and what she needs, and understanding how best to support her. So we have, as you can see here, lots of different topics and quizzes to really try to hone in on what Grace needs and how to actually support her and mobilize the PBS plan that we have for Grace. But beyond that, I really struggled to put into words, because I don't like talking about myself. I really struggled to put into words what makes us different or what is great about Billy Cart, because I believe we're unreal, but that's biased of me. And so I wanted to talk about how we unite our team and embrace the neurodiversity despite being in very different locations. And to do that, I asked my team. And so this is what they came back to. So we think differently and together, meaning that we are a team of neurodiverse, out-of-the-box thinkers who strive on collaboration and, really enhance or welcome multiple perspectives. And peer supervision is weekly, as well as having options to exchange ideas, grow together, and create evidence-based solutions regardless of that allocated time. We've got builds trust, or trust builds brilliance, so autonomy that empowers and not micromanages. So we replace the micromanagement with trust, and we give everyone the freedom to take ownership and lead with confidence. And that autonomy has resulted in a huge amount of innovation, pride in our work, and space to truly thrive. We've got flexibility with accountability. So we trust each other to get the work done, and that mutual respect then removes that element of micromanagement and replaces it with ownership. So my staff are really owning what they're doing, and they're accountable. We celebrate the weird and we embrace the real. So we generally celebrate the quirks and the personalities and the lived experience that everyone brings. And that's not fluffy values. That is what we've actually really embodied within Billy Cart. So we solve problems using this mindset, and we adjust our feedback depending on what your communication style is. You know, we are looking at trying to make sure that everyone is accepted for whatever their support needs are, both our clients and our practitioners and team members. So we have access without the hierarchy. So we have an open door policy and clear timelines. So we value direct communication with leadership. And this means that anyone can come to me. You know, I'm not too far away. I'm just a team away. And that helps us to stay aligned and on track. Beyond that, we also have service over sales. So we've got purpose-driven practice that we do. People first, always, not just for our clients, but also for each other. So we empower everyone to live their own life and overcome any challenges in a way that's authentic and respectful. We encourage masks off and magic on. So come as you are and thrive as you do. And the last one here that I want to leave us with is the leaders are on the ground. I have just as much of a caseload as anyone else, and I'm showing and learning all the time because I need to lead, but I also need to learn. And so that is something that's really important and something that we have for our whole team. And so, as you can see, Grace is poking my head.
I'm not touching
So
you.
I think we have hit our 5-minute mark. So thank you, Tracy.
Thanks, Sarah. Thank you so much. Really so inspiring to hear all of you share your passion and all the innovation and the different ways of thinking and looking at PBS and how you're all impacting change in such amazing ways, and the decades of experience and passion and sharing your journey is just so super inspiring. So I'm not sure if we have any comments or questions. If anyone wants to put some questions in the comments, please do that, and then we can share them.
Well, no, don't you?
Maybe interject.
Yeah, I'll interject. I love a chat. Again, with PBS, I really just love that we're in this space where it's not that it's new. The fundamentals have been around for some time, but the growth and the progress that we can make in terms of this collaboration, I'm really super passionate about that and the educational opportunities that will be available. I was going somewhere with this, one sec. So what I think is really valuable is that when you're at a company, for example, and you have a supervisor, one of the things that I'm passionate about is that it's okay. You're not sort of cheating on a supervisor, and you're also not cheating on your company if you can ethically go and learn from others as well. And there's been so many wonderful opportunities. Hello, Amy, I see you, Queen. Because there are times where I'm like, oh my goodness, but I am with this big company. And if I contact someone from this company that I think I kind of gel with, is that going to get spoken about? And then all of a sudden, everyone's going to get into an uproar. I have reached out to so many brilliant clinicians and gone, can you help me? And they're always fine to help. Like, it's cool. So I suppose that's the other encouraging thing, is that there are good people out there. Yeah, I love that we're nodding, because I love talking to people from other places. It's so great.
It is really important. And I think that's something that a few of you have touched on, is that I think when the NDS kind of first rolled out, I think we're all so busy and just trying to get stuff done that we weren't kind of collaborating maybe as much as we might have. Like some of us still were. I think that but I think now we're kind of going into a bit of a different space and time. And now it really is the time to come together and collaborate and listen to different ways of working. And as, Mitch kind of challenged us about PBS, and I absolutely agree that it is contextual and it is non-linear. It has to be. People are not stagnant. We're fluid beings. Like, we change every moment. All of us do. And that is the great thing about working in this space, is that we really have an opportunity to have an impact, especially the companies that aren't these companies that do everything and they do PBS on the side. Like, if you're focused on just PBS or just allied health, then you're really bringing something really specific, and you can advocate for people in a real way and give them a voice. And I think there's nothing more powerful than that. Like, it is so amazing. And I so appreciate everybody here. I'm just so excited. Has anyone got any questions out there? Some comments?
I don't have a question. I just have an observation. And that is, I believe that solutions are part of our role. And it's not just coming up with the solutions, it's actually crafting, creating, investigating. We are architects, I guess. And being an architect, a lot of the time, co-designing and co-developing and supporting people in whatever phase or stage of life that they're in. But what I would love to see, and this is obviously, I'm a one-woman show, with the exception of my amazing employee. I'm a one-woman show. I'm not a big provider. And yet I am privileged to work with 65 practitioners right across Australia. And I am an external supervisor. So thank you. Hallelujah. External supervision is I think it's extremely important, because I don't have any agendas. I don't have a single agenda in my supervisees' lives. I exist in that moment for them, and the only thing I care about is that they're not doing, a stupid, bad, unsafe job for their participants, because they're the ones I actually care about. I care about our sector. And so I agree that external supervision in that non-agendered way is extremely important, because there's a lot of fear amongst our practitioners. You only got to scroll through some of these Facebook groups that so many of us are a part of, that talk about asking questions, and then they're all anonymous. None of them are putting their names to these comments, because they're all scared of looking like they're idiots, but they're also scared of everyone saying, go back to your supervisor. It's like, well, I went to my supervisor. Hell, I've got three. I've got 3 external supervisors that I see weekly or fortnightly. So I'm somebody who very much believes in supervision, and even they've got no answers sometimes for me. So I think that the supervision, but the concern I have, and this is the reason why on LinkedIn a little while ago, I wrote a white paper. It's the first time I've ever written one. Bugger if I know what I was doing. It was like, this is the idea. Here's the problem. Here's some solutions. And it was about an accreditation council. Because the other thing is that, the commission is young, and our sector, our profession is in its infancy. There's a lot of experience in this room right now. There's a lot of experience in our sector, and we need to leverage that. I don't think that there's a single problem that we have in our sector that collectively we could come up with a solution. And that's balls out. There is nothing we can't solve together. But I also think that we need clarity, and we are behaviour practitioners. Some of us have disciplines in psychology, education, mental health, social work, nursing. The list can go on and on and on. Physiotherapy. But at the end of the day, we're behaviour practitioners. So we should belong, in my view, that, and proudly belong to that role and that sector. And where I find a big gap that I would love to see change, at least a conversation, is how do we bridge that gap? Which is the reason why I proposed the Behaviour Support Accreditation Council. It's not a peak body. It's not designed to be a peak body. At least that's not what I thought about it. It was designed to be something that supervisors meet this benchmark. Behaviour practitioners, as outlined by the Commission at the moment, well, there's gaps. There's gaps in service, there's gaps in quality, and that's evidence. We know that. There's gaps in training expectations, and then that's reflecting negatively and poorly in the sector from reputation. And it's like every single person in this room right now have great value to the people that they serve. I hate the fact that we're copping so much crap everywhere. We're getting it. We're copping it left, right, and centre. And I believe that we can do better.
Yeah, absolutely. And that's why we're here today, isn't it? To try and tip that over a little bit and share all the really great positive things that are happening and disrupt all that kind of negative talk. Absolutely. Any other
Yeah, well, I just want to add on to what Amy's saying there, because I think that is such an incredibly important, I think, way to look at where we are right now. I agree that PBS does sit as a discipline. I think, at the moment it can sit as a really robust, a discipline that we can look at and we can educate, with quite focused training. We at the moment are thousands and thousands. How many did you say? Was that 8,000?
About 8,000 registered practitioners.
Registered practitioners, and we're coming from, a multitude of amazing disciplines. You're right. I'm a social science background. We've got psychologists, we've got social workers, we've got developmental educators, we've got nurses. But what we are all bringing collectively is phenomenal, and that's something that we focus at Liberty. It's really important for us that we've got a pool of over 100 practitioners there, and my goodness, collectively, that is one of the most amazing amounts of information you will find in any repository anywhere in the world. It's incredible. So that teamwork is very, very important. That reaching out internally, externally, that's all really, really important. But I'm with you, Amy. I do believe that there is a place for a targeted, I guess, and focused, PBS training, and not in a negative. I don't mean that pulls away from what psychology brings us, what social work brings us. It doesn't do that, but it pulls it all together in a bit of a neater package. And I think it does give clarity to those people coming in the future. And we all kind of stay grandfathered, if you like. We're all here. We're all part of that building, these building blocks. But it's going to be a lot easier for those coming in to know, the expectations. The other thing, very, very quickly, is also we need to practice what we preach. For our practitioners, we need to also be, have our unconditional positive regard in place. We need to be using PBS, the elements of PBS, as in how we work with our practitioners as well. And that is incredibly important. So it's very, very hard when they've got this sort of punitive, worrying, challenging lens over this side. We need to balance that as much as possible. And we can. We can, and we do. We work hard in Liberty to do that, and it sounds like that everybody out there is working hard to do the same. So it's a great future. It's a good future.
It is. I think we've got a few questions, Helder, if you want to grab a couple of those from our amazing audience. So a comment and agreement that people saying go back to your supervisor if you're asking that you should be practicing. So how about this one, panel? A conversation around how we deal with difficulties. We make changes and reduce behaviours of concern, but providers refusing to adapt, positively viewing their clients. That is a really common challenge, isn't it? So does someone want to respond to that?
Oh, you beat me to it, Mitch. I was going to say, this is, as Tracy said, this is such a common experience that people have, is that you look at the behavior, not the person. And I think we need to look at the person first, and then teach people and understand also why they are looking at the person as behaviors. I can think of one that we're supporting with at the moment, who's a forensic case, and people are just seeing he had previously done, he's served his time, he's out, and that's all they see. They're not seeing the human that wants to go fishing and once was a chef and all of these other beautiful things. And for me, what we're looking at is we need the staff to see him as a human. So I need to figure out what are their motivators, what are their behaviors of concern, and what are their worries, and how can I support them to see this person differently while still balancing that duty of care, dignity of risk that, so often we have to balance. And so I think it's really important that, it's not just advocating so hard for the client that we forget that the people that support that client every day also have duty. We have a duty of care to them, and they also have the right to go to a safe workplace. And so we need to look at, well, what are your motivators? Why are you seeing this person as behaviors, not as a person? And then how can we support you to flip that narrative? And what are your barriers? And so I think we need to not just look at, just because the behaviors are gone, that means that all the vicarious trauma is also gone, because it's not. We still need to work and support on that side. But that's my 2 cents.
I think there's also culture. There's also culture. We sometimes can't change someone's culture. And I see this a lot in schools where teachers and educators where I'm working, they flatly refuse to change the way they're working or operating or the systems or strategies that they're using because it's in compliance of them, but it's actually not in the best interest of the child, for example. But I loved what Don was saying before about relationships. And I also love what Sarah's saying about understanding the underneath, the unconscious bias that our workers and our support staff sometimes have. Sometimes they don't have a lot of training or any, sometimes they don't get a lot of support on the job. And so understanding where they're coming from is, I think, really important. But let's just call it out here. Some people don't have the aptitude to work with our clients. Some people,
Correct.
and that's going to sound really unpolitically correct, but their aptitude is just as important as their skills. And so we can't do much about that when we're not the employer of those people. But all we can do is walk in with the human rights focus that we do, just as Sarah said. And as Don said, try to build and bolster relationship. And as Mitch said before, understand the context, but then finally try to meet everybody where they're at. Hence why behaviour practitioners are smack dab in the middle of a lot of situations and we're pulled from pillar to post. But that's our divergent thinking. That's where we can be really creative.
I would agree with you, Amy. I'm starting to see with, a lot more propensity in this space, and particularly seems to be more endemic in the in younger practitioners, particularly that there is this very narrow focus on, and you've touched on it too, Sarah, the fact that there's a very narrow focus on, these are the behaviours, this is the issues, this is how we need to do to fix this person, right? Like they're the expert. As soon as you're going to come from that position, we're going to have a disaster. And we've got a duty of care, that responsibility to understand holistically what makes up that person. They're more than just their behaviours. Their behaviours are symptomatic of trauma, experiences, all kinds of things. But we have a responsibility to see the person and understand that person, where they're coming from, what their journey has been, what their aspirations are, where they're going to. If we don't do all those things, then we're just ticking a box. And none of us want to be ticker box practitioners. I certainly don't. I want to be making sure that I'm making a real difference to that client and their lives, and creating a partnership and a journey with that client. Because after all, we're all in the same business for the same reasons. We want to get to a place where our client doesn't need us anymore. We're not here to trap them in that, perpetuity of BSPs and plans rolling over year after year after year. That's the best possible outcome for us as a practitioner is they don't need us anymore. That's what we're working towards. So I think we've got a real issue right now, particularly with recruitment and younger people, where they may have ticked the boxes, got their prac ID, think they're competent, think they have all the experience, but they just may not be the right person to work in this space. Just like we know sometimes some doctors probably shouldn't be doctors.
And I just really want to add. Oh, sorry. I really want to add on that, Dom, because you came up with a really good idea there, where with younger practitioners, we need to also educate, and all we need to do is think about behaviors and how long behavior change happens. And what we do is we educate maybe not, I wouldn't say the right way, the wrong way, but that we need to say, yes, there are evidence-based strategies. Yes, there are things we can do, but you will have to do these potentially for a very long time. And there's this idea, I think, that it's like, it's NDIS practitioners and they will have the answers because they work for NDIS and they're going to give me the strategy and then everything's just going to stop. And I try to relate it to when someone is trying to overcome, their own challenges of whether, I don't mean to simplify it, but, maybe we want to start walking every morning, or we want to start reading a book, 10 pages of a book every night, because it's better for us to do that. And then we do it for 2 days, then we go, oh God, I can't be bothered, or you want to do something else. We've got to give confidence in people that this is a long journey.
Yeah.
And this idea of, yes, eventually we would love you to not need us. It's about maintaining, and it's potentially for years. We're not talking 12-month plans and everything's fine. We're talking about 3 years, 5 years, a decade,
And
whatever it is.
And it starts with relationships, doesn't it?
Sorry,
you go, David.
Oh, my bad. You want to go, Tracy?
No, you go.
Okay. So one of the beautiful things here I find about our practice, your practice, is if we can drive that perspective shift to delay gratification and how beautiful that can be, and work on something over time versus the instant seeking of instant gratification and fixing things today. I think it's a realistic approach, and it can be a really beautiful one as well. And that's something that I think, in particular, we need to focus on over here. When, unlike for example, physiotherapy, we can see improvements within a week or 2 weeks, and adhere to protocols very, very, very simply, and the body will heal itself. This is a whole different kettle of fish. And so I love that perspective there, Bridget, that it's across the journey and embracing that. But anyway, back to you, Tracy.
I agree. Can I hop in, Tracy?
Actually, back to you. Absolutely, I give permission.
Thank you, David. I just want to agree with everyone's sentiments and just add to Lindy and to everyone listening that we have to take people on the journey with us too. So not just the client, but the people we work with. So if you're trying to gain that buy-in from the beginning and having those providers with you collaborating for those changes that you're making, they're going to be more invested and have the buy-in and understanding to walk with us. And then that's where we can start to separate from the people like Don is mentioning, the people that aren't willing to change and maybe aren't in it for the right reasons. But largely there's a lot of people that are here and entered the field for a positive reason. So we don't want them to be burnt out and pushed aside just because they haven't had the opportunity to walk alongside us and get that support and training.
Can I add something, or are we out of time?
Yeah, please go for it, Mitch.
No, I would add a few points. The first thing is the value of good assessment. And I think it's not assessment of the person, assessment of everyone. And it's trying to understand the patterns that are occurring in that context. I find the word, when we talk about, sorry, I'm suffering a little bit. I'm going to shift my focus. The understanding the people, the supports to the people and the settings in which they are, and understanding patterns that are occurring in that is actually critical to formulation.
Yeah.
And I think it's the clinical aspect of what I'm seeing out there that really needs to lift. And I think the good practitioners and the good leaders in this space are doing that, because if we understand really well what's happening, it allows us to draw the goals or the things we need to address in our interventions. And I'm probably not making a lot of sense right now because I'm not feeling my head's working well. But in doing that, if people can undertake an assessment, and I mean write an assessment before they draft a plan, and really get clear on the why, that seems to be what makes a difference. And in doing that, you can address or identify people who may need support because the trauma they're experiencing through care. You can identify cultural, you can identify all those other issues, and you can also identify the lack of supervision, the other supports that are sitting there behind them, and whether the organizations are actually culturally appropriate, whether the organizations are supporting their teams well. Because I think one of the things we don't want to do is label the person and the behavior as often the symptom of something else that's going on around them in that space. And the final point there is that we're really looking for what I would call a therapeutic milieu to occur. So a relational space around the person that is safe, that is supportive, that is actually able to be attuned to the individual and their particular needs and adaptive and support that individual to grow and reach their own potential. And that's my final comment. It's really about where are you? It's not the process, it's the goal we're heading to at the end of the day. That's really key.
Could I just add one more thing before we head off? Look, I just want to really simplify the way that I guess that I'm looking at things and how we can move forward. It's remove the politics. Right? Take that out of your thinking. Yes, we've got, there are businesses to run. We've got all of those challenges there. We've got compliance to deal with, the sweary word. But let's remove the politics, unify, work together. This is great. This right now, this is great. So that shows you where we're going. Yeah.
So I'm just going to do the rounds, let everyone have a last comment, and then so we can wrap up. So Sarah?
Why did you have to start with me? You're going backwards now. That's not fair. I haven't got a last comment other than stop it, Grace. Other than thank you everyone for coming, and it's been really great to have so many amazing and passionate practitioners all in the one space that are actually, looking at the human first, like I said earlier, not the behaviors and not the general, I guess, cookie cutter approach. So thank you all. And I'm going to go back on mute before Grace says something inappropriate.
Thanks, Sarah. Jessica, last comment.
Just that, thank you so much for this opportunity. I really see the benefit of this in focusing on the positive for once. That negativity really gets all the attention, and it's just been an absolute honor to panel with these panelists here who are just, I can clearly see the passion and the, the positive things that you're bringing to this industry. It's just an honor to panel with you all. So thank you for having me.
Thanks, Jess. Mitch?
Really love the creativity, really love the diversity of thought. I want to point out practitioners are important, but the organisations that employ them and support them are probably more important to growing the best practitioners we can to make the difference out there in the world. And I want to encourage everyone to continue to grow and develop and be inspirational in their own practice with their organisations.
Thanks, Mitch. Don?
Yeah, I think I want to pick up on that point too. I mean, one of the things for me has always been this idea of legacy. I started this business to try and make a difference in this space, and my whole purpose ultimately is to try and educate and ultimately skill people to become better practitioners so that they leave their own mark and their own legacy in this space. And I think, we're all trying to empower people to make a difference in this space, but also be better in this space. And, it's great to work with every one of you and share with you all your knowledges and experiences. And it's nice and refreshing to see that so many people share the same kind of vision and share the same kind of values. And, thank you for the opportunity. I'd love to be a part of things again.
Thanks, Don. Amy Flynn?
Thanks, Tracy. Yeah, I want to reiterate what everyone said. It is an honor. It's been such a privilege to be here today and listen to everybody's ideas and their passion. It really is inspirational. And that my final point is just that innovation comes the most in difficult times. So if we are in a difficult time right now, great things are going to come from this that won't just benefit us, but will benefit the whole field and our clients. So I'm really optimistic, hopefully not in a toxic positivity way, but I'm really optimistic, especially after hearing all the points from the people here and seeing the comments, that there's so many amazing people that are driving change. And we'll look back on this time 10 years, 20 years and think, wow, look how far we've come. So thank you, Tracy, for arranging this.
Thanks, Amy. David and Bridget.
Start with Bridget, though.
Oh, hello. All right. Really quickly, I think this is just an overall more philosophical thought to finish on, not necessarily about PBS, but just as humans and human behaviour. Be curious. There is no certainty in life. Everything is uncertain. It is okay to not know everything, yes. Even as someone who is a supervisor and a lead and everything. I read about things every day. I live the NDIS guidelines. I'm constantly reading, clarifying, questioning. critically thinking about stuff. And I think that that's really important as well. Live with uncertainty, and it's a little bit more comfortable and real, and be quirky and curious. The end. That's it.
I love that. I would just say that we're at a very exciting time in history, where so many other professions have super strong foundations, got a lot of legacy attached to it. I think this is an opportunity for us to seize if we want to, and to imprint how we want this to look like. And so I think this is a good step forward. I'm super excited. And like Bridget was saying, embracing uncertainty, like from The Greatest Showman, if it's crazy, we'll live a little crazy, okay? It's not that bad. And it's exciting. So let's go on that journey.
Thanks, guys.
You're up next.
Amy.
Couple of thoughts. Thanks so much for having me as part of the panel. It's always a surprise to be invited to these things with me, because I sometimes feel very uncomfortable in these spaces, but it's an honour to be amongst some really passionate, excited change makers in the space. For the practitioners that are watching, I am a sole trader, and I've had the ability to have over 10,000 hours of practice, which means I've had 10,000 hours of opportunity to change people's lives for the better. That's the power I have in my role. It's exactly the power you have in yours. Take it that seriously. The other thing, and when I say take it that seriously, not only do you have the ability to change their lives for the better, you've also got their ability to not, to the opposite, to take that role as a privileged role and understand your why. Why are you doing this job? And on the bad days, and you'll have plenty of them, that will hold you to the job. And it's not a billable hour thing, and it's not a capability framework thing, and it's not an NDIS thing. It's about that. The last thing I'll say is that you will live your life, and I say this to all my supervisees, under a banner of perpetual frustration in this job. That's it. It's as simple as that. Get comfortable with that, because you're not going to have the answers. And when you're incredibly passionate about change and growth and support, you're not going to achieve what you really hope to achieve. And that's going to push you out of your comfort zone. And nobody ever grows comfortably. So in your job, stay true to the reason that you got into it in the first place. Find your heroes. Find the people you look up to in this industry. Some of them are in the room for me. Sarah McCluskey, holy crap, she's one of my heroes. I can tell you that right now. And the reason I say that is because on days where you don't have a clue, your heroes will bring you back. So find them, nurture them, and invest in yourself, because it's worth it.
Mm-hmm.
Thanks, Amy. Julie.
Wow, how do you follow that? Okay. Look, this has been incredibly inspiring for me. I know that we were, the agenda, I guess, was to come in and to talk about all the great things occurring. But this in itself has been really inspiring, listening to what I believe is this next generation of leaders in this space. And that's exciting. So that 20 years, Amy Flynn, 20 years from now that you were talking about, I'm hoping I'm retired and a little bit, and so I hope to look back and see what's happening from an outsider's perspective by then. And yeah, look, I'll be cheering you on from that space, guys, because this is great. Thank you.
Okay, well, I just want to say thank you so much to each of our panelists, and I really hope that everyone watching today got as inspired as I have, just hearing everyone's experience and journeys and focus on the people that we work alongside of. It is not, behaviour support is not about reducing behaviours of concern. It's uplifting and walking alongside of people and helping them find their voice and supporting and advocating for people and building genuine relationships within a messy context of our lives. We can have such a positive influence and impact if we just focus on how amazing every single human being is and allowing them to shine. There is nothing better than working in this space. So I just want to thank you all so much for each of the panelists. Thank you to all the practitioners, PBS providers, anyone that's interested, that's watching us today. We sincerely appreciate your time and hope that you got some inspiration to keep going and keep doing the amazing things that you're doing. Behaviour support is something that we're really going to be trailblazers in Australia. We're going to forge our own path and really stand up for people and stand alongside of people and celebrate humanity. So thank you, everyone. Thank you so much. And we'll see you all again soon. Thanks, everybody. See you. Bye-bye.